Hi, it's Dr. Dawn. I'm going to show you guys today probably the most frequent exercise that I show people in physical therapy. It's commonly used for low back pain, but it really helps just with upper back pain, lower extremity pain, it's core stabilization, and it's lower abdominal strengthening. Commonly when people think of abdominal strengthening, they think of like crunches, sit-ups. I got to do a ton of sit-ups and strengthen my abs. What we emphasize is the lower abdominals, so that's your transverse abdominis, your internal, external obliques, and basically they're like a corset to your spine, and they help support your lower back. A lot of people with low back pain, whether it be from a disc herniation, arthritis, a strain, whatever, benefit from core stabilization. Or if you could be like me, I just had a C-section. I'm not allowed to do a lot of sit-ups and crunches. It's actually contraindicated, so I need to do a lot of just lower abdominal work. So I'm gonna show you guys this. You can do it sitting or standing, but it's easier to start with it laying down. So lay on your back on a very firm surface. At home, the bed would not be the best choice. Probably the floor would be better if you don't, because you probably don't have a table like this that's nice and firm. So when you're pulling in your lower abs, you don't want to suck in like that and use your diaphragm. You actually want to think about pulling your belly button in towards your spine, okay? So you feel like you're pulling down and in towards the floor, okay? And then you count to 5. And then relax. So pull in, 2, 3, 4, 5, relax. Pull in, 2, 3, 4, 5, relax. So simple, right? It seems simple, but a lot of people really have a hard time finding these muscles and contracting these muscles, especially if they're having really bad low back pain, or they're, sedentary like most of us, sit all day. These become very weak and people have a hard time getting that contraction. So basically I usually do 3 sets of 10 just like that, 5-second holds, okay? Then a progression for this exercise would be to add some leg lifts. So you could do pulling in and then lifting one leg and down, just like a march laying down. And that would be 1. Pull in, lift, lower, lift, lower, 2, okay? Now the next progression up from that, even harder, would be pull in, lift one leg, then the other leg, like that. Now if you can see me, mine are a little weak. I actually came up a little bit when I did that. So you really want to keep this tight, lift, lift, lower, lower. And you can do it set of 10, work up to 3 sets of 10. So you shouldn't have any pain with this exercise. If you have any low back pain, stop. The isometrics, even just doing those will strengthen your abs and help support your spine. So hope that helped.